Welcome, everyone, to our session entitled Balancing Act, Wellness During Treatment. In this session, our panel of patients and healthcare professional experts will address the different areas of well-being and explore strategies to support wellness throughout treatment. This particular session supports a previous session where we talked about an early diagnosis. I've just been diagnosed with cancer. We're going to talk after this session about post-treatment. So this fits into the phase of wellness during treatment. Joining me today are four wonderful people. First, I'd like to introduce Dr. Eric Marsden, who is a naturopathic doctor at the Marsden Center for Excellence in Integrative Medicine. I'd like to introduce Patricia Walicki, who is a patient advocate, Shane Benish, who is also a patient advocate, and Chelsea Butler, who works with Colorectal Cancer Canada as a patient support specialist. Welcome, everyone, this morning. In fact, this afternoon, pardon me. Patricia, we're going to begin with you. Thank you for joining us today from Ottawa. We're going to talk a little bit about where you're at in your cancer journey, particularly related to some of the treatments that you've received and how you're managing your wellness within the context of that.
Thank you, Anne-Marie. I appreciate the opportunity to have this discussion. I was diagnosed with colon cancer last year in May of 2023, and I had went through chemo and then a couple of surgeries. So I'm in a pretty good place right now, but I was thrown headlong into this journey like many of us have been. The diagnosis came as a complete surprise. So I really had to hit the ground running. And from a wellness perspective, I found that people meant well, but immediately one thing they wanted to do to help was to give me all these ideas about resources and have I tried this or have I thought of that? And in the beginning, that was just too much for me. And from my, only speaking, of course, to my personal experiences with this, for me, it was a lot, and I needed to get the practicalities down. I needed to figure out where I was going for chemo, what that involved, and everything like that. So I think I just want to lead in by saying it's so individual what you need and when you need it. But my thought for me was that once I kind of got my feet under me, a couple sessions of the wonderful FolFox, then I started to look more at resources because I thought, I have no idea what I'm going to need. I have no idea how, what will be useful or anything like that. So then I was just gathering up a whole bunch of information because I thought, okay, well, maybe that'll help me figure out later on when I might not have the energy or the brain power to dig in to find things. So I found living in Ottawa, I have a lot of terrific in-person resources, but I've also found the value of the virtual resources. And I did find one thing for me that I was very lucky is that my workplace has a system for sick leave and disability insurance and things like that, and some really terrific people and coworkers who helped me navigate that system. And so I didn't have that angle to work with. And sometimes we downplay the importance of financial security and job security as part of wellness, but it can definitely put your mind at ease to be able to focus on other things with your mind and body and everything going on, and availability for appointments and things like that. So for me, again, it really was a lot about the timing. So I was very lucky with some of the resources through the psychosocial piece of the Cancer Center here. For the dietitian and the social worker were absolutely wonderful, but they're very hard resources to get. And if anything, I always make the plug for that to be more accessible to more patients in treatment. For me, it was super, super important. And I had the dietitian right from the beginning, and that was terrific. The added bonus to that is those professionals could see my charts. and on the computer. And, sometimes you get tired of telling the same story again and again. And so it was kind of helpful to be able to talk to the dietitian and not have to maybe repeat everything and things like that. And it sounds like a small thing, but you tell your story so many times to different healthcare professionals that it can be draining too, right? Like it can take some of your energy away from you. So it was all about doing what I could when I could. And then I had a very supportive healthcare team who also, recognized the benefit of mental health supports and exercise and things like that. But exercise is, we're going to talk more in the session about it. But for me, I did find that word was kind of interesting because, you have to redefine it for wherever you're at within your treatment. And so I'll leave that a little bit there, except to say that, I think we're all going to say you need to find something that works for you, and it might be a stepping stone to something else that you like. Being able to walk more will help you, maybe garden more, things like that. So I found some of those things very useful. And then just finding the support of people that will be with you, whatever you're able to do, and understand that, unfortunately, that can differ day by day. And that's something, it's the uncertainty and the lack of ability to plan that can be really hard for the wellness balance, I think, because you can enthusiastically, set up, maybe some exercise or activities for the week. And it's great to have those goals. But the reality is you sometimes have to shift them a little more than you would like on the fly. And having folks around you that will work with you on that is great. And being able to ask for what you need, that was something that I really had to learn. But a lot of that was just because I had no idea what I needed, right? Like it was hard to say what would be useful, what would be helpful. But I did find it really valuable in the beginning. Well, not quite the beginning, because that was a little too much. But then once I was a little bit into chemo, had that under my belt a bit. Once I gathered up some of the resources, got in touch with a cancer navigator, patient support, and different resources like that. So that's, those are, really some of the key pieces.
You've launched and you've really given us a wonderful overview, Patricia, of so many things we're going to get into quite specifically and talk about. But thank you very much for sharing the journey thus far. Shane, I want to bring you now into the conversation and get your perspective on where you're at and some of your own strategies and ideas around managing your wellness.
Thank you, Anna Marie. So for me, I was diagnosed with stage 3 rectal cancer in February of 2022, actually the day before my 34th birthday. It came as a complete shock. I had been dealing with some minor symptoms, but the word cancer never crossed my mind, not even for a second. I had kind of these forms of cancers are, kind of in a sensitive area. Maybe there's some feelings of embarrassment, and I didn't address things, as early as I probably should have. So that's, one thing I'm kind of really passionate about now, and thankful for this organization raising awareness, is for people to take things very seriously. If something doesn't look right, doesn't feel right, see your doctor. Don't feel embarrassed, don't feel ashamed. We're all humans. We all experience the same thing. So speak up and get yourself checked out. Yeah, basically diagnosed February 2022, and just jumped into treatment pretty quickly. Got to meet the care team in Ottawa. A lot of great people. Honestly, that's one of the things that makes the whole process the easiest. Just how many caring people you meet, doctors, nurses, radiologists, makes it a lot easier going in for your appointments. So basically, I started pretty quickly within, I think, 6 weeks of diagnosis with chemo radiation. And I was really fortunate to tolerate that pretty well. Honestly, I think the worst part was just having to have a a full bladder and make the hour-long drive to Ottawa. But yeah, it went well. I was able to stay active throughout and run daily, and that was a huge thing for me throughout treatment. Like Patricia mentioned, it's your exercise, your activities will change as you go on, but for that part, I was able to continue running, and for me, that was really helpful, just getting out alone with my thoughts. Some days just shutting your mind off, but other times doing some great deep thinking while out on your own. So yeah, that went well. After that, I started on Kpox, and that was a different story, especially the first week following the IV treatment. That would kind of stop me in my tracks. So, a lot of time on the couch, some nausea and stuff, but not too bad. At that point, I was mostly just going for walks, and my wife would push me to get up sometimes when I didn't feel like it. So just going out for walks would help my mood a lot, and I also found it helped with the nausea a lot. The second and third weeks of each cycle were not so bad. I was able to be a little more active, get out in the garage and do some woodworking, some gardening, just, find things to keep busy. Because it is also kind of strange now having all of this time, I'm used to working a lot. I travel for work, so to now suddenly be home all the time, and it's a lot of time to fill. But that went well. Around end of 2022, it was looking like I'd had a complete response to the treatment. Unfortunately, the biopsy came back still showing cancerous cells. So in February of 23, I went in for ultra low anterior resection to remove my rectum, and that left me with an ostomy. So this was something throughout the treatment I was super against. I didn't know too much about them, but there's a stigma around ostomies. And as a young male, like, that was something I didn't want. I didn't want the surgery. I fought with my surgeon, can I do more chemo? Can I do anything to avoid this? But ultimately, it had to happen. And I think in the long run, it was better than, for me and for my wife, it was better than going into the wait and watch, afterwards. Less stress, just having it gone, there's no more cancer in you. It's fine. So before the surgery, meeting with an ostomy nurse, that was a huge help to me, just actually finally seeing the products and learning more about it. And it didn't seem like such a big deal anymore. So I decided, I'm just going to take this on as a challenge. I'm going to still try to do all the things I love, actually do a lot of things. The whole experience taught me to make the most of your time. Don't leave things for later in life. I used to do that a lot. I'd tell myself I'll pick up this hobby when I'm older, when I'm not traveling anymore. But now I decided, you have to enjoy your time while you have it. Nothing is guaranteed. So the last year with the ostomy, I did a ton of hiking, running, did my first marathon in years, got into road cycling, and all of this is possible with an ostomy. It's not going to stop you from doing anything that you want to. But then come this February, I was able to have a reversal. So basically, I'm about 2 months post-op, getting used to things, the new normal, but no complaints. I've been really fortunate through the whole experience, and I can honestly say it's I think it's improved my life, because it's changed my mindset a lot, and I think my life is going to be a lot better going forward. So you can always take positives out of any experience, even though I know a cancer diagnosis is very negative. But there is always a bright side.
Yeah, what a beautiful philosophy, and a perfect way for me to bring you, Chelsea, into the conversation, which both Patricia and Shane, they spoke initially about what I call the shock. It's almost a trauma, fundamentally. that they have been dealt with, and both of them have found their way through that trauma. I'll use that word. You'll correct me if as we go through this conversation, but really what happens to a person at that initial phase of diagnosis where it's very traumatic, and then both of them have found their way to high resiliencies and philosophical change. So maybe you could talk about that process a little bit and how others should think about that.
Yeah, absolutely. And what they've described is absolutely a trauma. A cancer diagnosis is an event or circumstance that results in physical, emotional, and life-threatening harm. So it does qualify as a trauma. And what happens when we experience trauma is that the memory is stored in the amygdala, which is the emotion part of the brain. And then when we are in the emotion part of the brain, it's very hard for us or impossible for us to enter the prefrontal cortex, which is used to make decisions and reason and make meaning of language and all of these things. We enter a survival mode, and some people will be in fight, flight, or freeze. Things that didn't have a large impact on you previously may now be thought of as dangerous in your mind. For example, a morning walk in the neighborhood may have been, a routine activity each morning before, and now your mind may think of every bad thing that could happen on that walk, and it turns into a dangerous activity for you. So, a lot of people experience exhaustion and trouble finding words and putting sentences together, and some folks even have the somatic and or physical related symptoms as well, such as trouble sleeping or aches and pains. What I've heard from Shane and Patricia is that they have things that bring them joy in their lives that they've brought forth and sort of worked through this trauma in a way that is healthy, and they're bringing in things that they enjoy, and they're not necessarily distracting themselves, which is what we want to hear as mental health practitioners.
Yeah, fantastic. Dr. Marsden, welcome. Thank you for being with us today. Both Patricia and Shane really focused on taking care of themselves outside of their treatment, using exercise, using mind, body, spirit. I'll use that language, methodologies. What's been your experience and with seeing cancer patients and how they've done well using and activating strategies of that nature?
First off, thanks so much for having me here. Yeah, I mean, really, the stories that we've heard are common, but the amazing part is you both have had, both Patricia and Shane have had been able to bring on resources to help support the whole individual. And I think that's one of the challenges is we can get caught up in the primary care side and cancer care side and forget that there's the whole person. Patricia, you mentioned the financial aspects. There's the mental health side, which is woven all throughout. I agree 100% that cancer diagnosis is a traumatic. I really treat every patient who's going through their journey as somebody who has PTSD, because really they exhibit all of those forms of that. But the great part is patients can be empowered, that there's a lot that you can do. And I think that's one of the challenges, is there's a sense of helplessness in many cases, depending on where you are in your pathway. And there are great things, whether it's on the mind-body medicine or mind-body spirit, however we're going to call it, whether it's on the diet and the physical activity. And the most important part is really meeting each individual where they are. So I think, Patricia, you talked about the fact that you were overwhelmed at the beginning, and certainly in that state, throwing diets and physical activity plans, and this is what you're going to do meditation-wise, is going to land pretty flat. So we have to tailor our recommendations and tailor each individual's care based on where they are. I think there's a great fear for individuals of doing something wrong or missing out on doing something properly. And, that's the great thing about these dietary and lifestyle measures, is there is no right and wrong. It's what's appropriate for each individual from where they're starting at. And there's great evidence in the literature on this, and certainly we see it pay dividends in practice. So, fatigue and cognitive changes can be one of the more challenging things that 90% of patients experience. But the great thing is physical activity and movement can be one of the greatest therapies for that. And most people think about physical activity like running a marathon, which is often, depending on where you start, is just really not realistic. It really is movement and movement in nature and movement with individuals who you care about and care about you, or you can at least tolerate, because there can be a loss of social connection. So we can use different tools in terms of physical activity, food, as ways to look at the individual on the whole side. And so what's really important is that we meet each person where they're at, look at different resources, whether it's on the mental emotional, whether it's getting them into some form of counseling, social work, psychotherapeutic interventions when they're ready, looking at, I call this bottom-up approach and supporting the nervous system, because as we heard, sort of our broader thinking gets short-circuited by trauma. And it's sometimes very hard for us to sort of calm down. So we can use tools like physical activity, like meditation, mind-body medicine, somatic work, etc., to help work on both the top-down and bottom-up in terms of the nervous system, and then tailoring plans like diet and physical activity. And those things, a lot of people don't realize how meaningful, how important, not only in how they feel, but the outcomes of their treatment.
Yeah, I think it would be fair to say that intellectually people understand that some of these modalities, mind, body, spirit, diet, nutrition, exercise, etc., are the right things to do. But Patricia, to this point of when you're ready, to this point of understanding what's right for you at the right point of time, how did that look for you? How did you know when? You're very busy getting the physical treatment. Then how did you know when the right time was for you to start to add some of these things? How did you get there?
For me, it was really just figuring out my routine, understanding when to get blood work, where to go, how to get to the chemo, what was going to happen during it, and get a little bit of a feeling for how that would unfold. So it was that practical, okay, and then where do I go get the bottle unclipped? Where do I, how manageable is that? And once I went through a couple rounds of the chemo, that's when I really started. And it wasn't so much of a health knowing too. It was a little bit of a calendar. It's like, well, it was very manageable the first couple rounds. So I thought, okay, in case it's not, who knows what's next? I should maybe, look at some of the things now, and to give me some ideas, because people were offering to help, and I wanted to value that, but I didn't know really sort of what I need. I know I keep saying that, but I think that's important, because people will look and be like, what do you need? I'm like, I have no idea. And also, while it was manageable, and the surgeries and everything were very manageable for my liver and my colon, I don't want to take away from also that sometimes, because your pain's under control, sometimes that is a very step. And to mention is all these things will help with pain management too, but sometimes you do need to kind of get to a point where that is more possible. So I found after the surgeries that was a very valuable piece for me.
It was the next step, so to speak. Yeah. Now, Shane, I want to ask you the same question, because impressively you ran a marathon, and I have to. I'm sure many people are impressed with that. At what point did you must have gone through a process yourself where you went, can I, should I? What was it for you that said this is a good thing for me to do? At what point did you know that this was the right path for you to be on?
So I guess it was after my first surgery, after the anterior resection and having the ostomy. It's kind of hard to trust your body. I had the advice of my surgeon, because I had been itching to get back to running. I hadn't been physically able to during the K-pox. And then obviously during the recovery from the surgery, not much physical activity. So when I was cleared, I was pretty excited, but at the same time, trusting your body again to go from just walking and sitting on the couch a lot to going out for that first run. It's definitely, there's kind of a mental block there. So it was a little strange at first, but I remember in the beginning, my wife who was, you know, with me every step of the journey, she would come out on her bike and just run alongside or ride alongside me while I ran, just to, you know, keep an eye on me, make sure everything was good. So in the beginning, started slow. Just have to be patient with yourself. It takes time to build your strength back up and everything, but I knew it was something that I had been looking forward to getting back to during the treatment, and something that, you know, makes me feel really good and brings me a lot of joy. So yeah, as soon as I got the clearing from the surgeon, I was just ready to get started.
Yeah, thank you very much. Chelsea, this idea of whatever you need, whenever you need it, it's kind of an obtuse concept, and that we're playing with a little bit here. And maybe you could shed some light on what that actually really means and how people can think about that.
So each individual, even if you've gone through the exact same situation, the same diagnosis, treatment, each individual will have their own unique response to that. And so sometimes it helps to step back and look at the bigger picture and determine what it is that you need. And that may change throughout the process, and that will be different for each individual. And so for Shane, it sounded like getting back to that physical activity was important to him. And so that's what he did. He took the steps. And he also mentioned this forming back the trust. A lot of times when folks do go through a traumatic experience, they do lose trust, whether it's in themselves or others. And some people feel that their body has wronged them when they're diagnosed with cancer. And so getting that trust back is an important step. And it sounds like, you know, I just want to applaud you, Shane, that you did everything you could to get that trust back, even having your wife, or even though she chose to, come with you and just sort of be with you in that moment, was a very important step there.
Thank you, Chelsea. I wanted to get into, again, a little bit deeper on this idea of how a care team can best support you. And there's a lot of things when we talk about care team. There's the team at the hospital, which are your oncology teams, your nurses, etc., and all the way through a trajectory of what I call physical care to emotional care. So let me start, and we're going to break this down a little bit as we go. Patricia, you mentioned that you had an excellent care team at the hospital. Shane, you said the same thing. So it's maybe you could help us set expectations of what you got from people who were physically giving your treatment at your hospital, and how you had to reach out into a network to find other things you needed to be part of your care team. And Shane, I'm going to ask you the same thing as well. Like, what can you expect from whom? And then Dr. Marston, I'll bring you into this as well.
I guess I'm answering.
Yeah, thank you for starting.
My healthcare team was fantastic in that they recognized and were fairly clear about like what their scope was and offering other opportunities. With the challenges, I only just got a family doctor last month. So I've been going through this without a family doctor. And I think a lot of people are in that situation. So that is a support that, you know, we all recognize that is needed, but I just have to, you know, throw that out there one more time, that really that's a missing piece in some puzzles. I was very lucky that some of those gaps could be filled in a little bit differently, but nonetheless, that's super important. The healthcare teams were very patient-centered, very much on the introductions and the patient care lines and everything like that. The psychosocial with the social worker was able to sort of help me fill in any gaps of what else might I need. And the cancer navigator, whether it was finding some names for some psychotherapists that might have sort of not expertise in patients with cancer, but you know what I mean. And with or sort of exercise programs available either online or at the Cancer Center here. And those are and you know, even the print material from the Colorectal Cancer Canada was just very useful to because I sometimes joke that way you're not Googling, you're kind of flipping through, and that can be a way of just getting the information you're looking for without maybe some of the other stuff that you just don't need right at that moment. And that was helpful for sort of looking at what other resources might be useful at different times. But it is a big team, whether it's your pharmacist, your eye doctor, your dental hygienist, all these people have bits of knowledge that are really very useful. And then not to speak to your experience, Shane, but I'm suspecting you probably had a couple people who maybe were wondered if you were overdoing or different things. Just based on my experience, every now and then someone be like, are you doing too much? And really it's listening to the right voices too. You know, listening to your team and listening to your friends and family that are understanding of that, you know, you need to stretch things a little, or how you're feeling, that we understand our bodies as we rebuild the trust. But yeah, that's it's a wide net.
Shane, maybe we can pick up on that too, is I'm not even sure that people fully understand, and it'd be helpful for our audience today to know that they can never mind the resources that are available, but there's so many people who can support them in their cancer journey. And Patricia, you mentioned a dentist. You mentioned a lot of allied healthcare professionals. Many people might believe it's only the team at the hospital. So just talk, it would be very helpful if you could share your experience with what I call that circle, or that network of people that you use to help you in your own cancer treatment.
Definitely. So, yeah, we're super fortunate to have a really wonderful community. Right from the start, meeting my oncologist and my radiation oncologist, the nursing staff, there's so much information available. Kind of like Patricia said, you know, we all want that info at different paces. So for myself, in my day-to-day life at work, I'm in project management, so I'm always looking ahead. I'm always planning for all eventual outcomes or all possibilities. But in my personal life, and especially with the cancer journey, I didn't want to be like that. You know, I don't need to think of all the different possible outcomes and have a plan for each of them far in advance. Just leads to worry. The Googling, you know, you can get yourself into a state if you do too much research online. But just knowing what was available to me and how to access it when I wanted was great. There's a lot of great resources from the Ottawa Hospital and Colorectal Cancer Canada. Also, I found it really useful finding some online forums where you could, you know, communicate directly with people either going through the same thing as you were, or people who had been through it before. Even now, I still try to participate just to help other people out. But you know, every day going into the hospital, the staff is always super friendly. I can honestly say I didn't meet one person the whole way that wasn't like a wonderful human being. And I truly don't know how some people do this kind of work, but I think it takes really special people. So, you know, they're always super helpful, always happy to answer questions, point you in the right direction if you don't know where to get something. I will say one thing, you do have to sometimes really advocate for yourself as a patient, because while there are a lot of great people in healthcare, you know, a lot of them are sadly pretty overworked, or departments are understaffed, you know, so things can fall through the cracks. It's just the way things are. So you have to speak up. You have to ask questions. You know, make use of the resources like patient support lines that they have in Ottawa. It's really helpful. Then outside of work, I found, sorry, not work, outside of my care team, I would find people in my personal life, they don't all know how they should act around you. I found some people would kind of stay away or not talk to me so much because they would feel like they were bugging me, you know. So don't automatically feel like people don't care about you if suddenly they're not so active in your life. It can be difficult for people around you to kind of know how to act, and I think for really close loved ones, sometimes it can be harder for them. I think personally, having been through the whole experience, you know, I would rather be sick myself than to see someone that I really cared about be sick, you know. I would rather go through it than watch a loved one. So it's kind of it's hard for them as well. And I think we can kind of understate how hard it is on the people who are close to us. Sometimes it can hit them worse than you know, us ourselves. So you know, reach out to people, let them know how you're doing, and that's, you know, it's not a bother. You might be more tired or sick sometimes, but you know, you're still the same person, and they can still interact with you and, you know, continue your relationship as before.
Thank you, Shane. And I would be remiss if I did not say how important, Patricia, Shane, it is that you're here, because you are being of service to others just by being here. So thank you. I want to bridge, Dr. Marsden, back to you on what I call the value of integrated care. I think a lot of folks think, I'm going to the hospital, I'm getting my treatments, maybe I'll do a little of this or a little of that. But if we look at this more holistically, I think it's fair to say that people in general do better. Can you just talk about the approach to integrative care, what that really means, and how people should think about this?
For sure. You know, I think one of the things that's important is the patient experience can often be determined in part by what center they're at, and the resources that center has. And so it sounds like you both have been at a center that is well resourced, that where the oncologists and the care team integrate those resources nicely. And not every patient has that, or has access, or is an advocate. There's also huge important with organizations like Colorectal Cancer Canada being patient advocacy groups and helping with navigation and so on. So this is really important. But one of the advantages of integrative providers is having a healthcare professional who already has an idea of the whole person and can look at different modalities and aspects of health, because in general, providers can tend to get siloed into their particular area and only deal within that and miss, whether that's within oncology, radiation, medical, surgical, or whether that's, you know, a medical doctor. You'd mentioned even having a family doctor. A lot of patients, even the ones who do have family doctors, there can be a gap in that handoff of post-treatment of, okay, when does that family doctor take over? So, you know, integrated providers, particularly ones with additional training and certification, naturopathic doctors, there are fellowships in integrative oncology. We have postgraduate residencies in our group. There's actually published standards of care or guidelines on best practices in integrative oncology that talks about whole person care and all of these different aspects. An integrative provider can also help to prioritize. So, you know, one of the big things that we had as a theme or a question is, okay, what do I do when? And sometimes it's that gut feeling of, okay, I'm ready. And sometimes it's a matter of an integrative provider saying, well, listen, what are the barriers right now for your wellness? What are the barriers maybe to care? And so what are the tools we can use to help address those? So if it's fatigue, what are the different tools we can use to support that? I mean, if you've got physical measures that can be making it very hard to do any level of physical activity, maybe we need to look at other things. Maybe anxiety or depression symptoms are a huge barrier for you to be able to access different care, just to maybe there's isolation. So maybe we've got to focus on some of that mind-body side. So this is one of the advantages of an integrative provider, is looking at, okay, where are those priorities? And also knowing within which priority area, like diet, for example. I think one of the biggest questions I get is on diet. You know, what's the right diet? Because, oh gosh, if you Google that, the last time I checked, I think there was something like 32 million pages on diet and cancer. And the reality is there's no one answer. We do have certain, there's a lot of evidence behind things like higher intakes of non-starch vegetables, reducing animal protein, and so on. But, you know, if you're in the middle of your treatment, and let's say there's some obstructive symptoms or other things going on, having tons of raw salads and vegetables could probably be the worst thing that you can possibly do for yourself. So it's really important to look at, again, prioritizing, understanding where you are in your care pathway, your symptom approach, and this is what an integrative provider can do. And then also post-treatment of how do we restore wellness? So, you know, we talked about physical activity. How do we trust our body again? And there are great tools, you know, everything from call it Borg exertion scale, and that can be done during treatment and afterwards, of tracking your perceived rate of exertion and creating guidelines of where do you need to be operating at for what period of time. And so working along that with surgeons in terms of restrictions on different activity, you know, we can get people moving and feel comfortable that they can do these things safely. So there's less of a fear in doing some of these interventions. So I guess I would say that, you know, an integrative provider can look at all those things and then, of course, answer all of the other questions of, I saw supplement X for you. Do you think, have you tried this? Have you tried that? And being a central repository for people who understand these different therapeutics, non-conventional therapeutics, and are they appropriate? Are they safe? So yeah, I think those are really the critical pieces of care that an integrative provider can bring into a patient's journey.
So a very simple question, if someone is interested in what I call whole body approaches, how do they even get introduced to an integrative team? Is that through the hospitals? Is that how does that work?
You know, it depends on the hospital. Unfortunately, in Ontario in particular, and other areas of Canada, there can be barriers between conventional and non-conventional, often understood as integrative care. Ottawa actually is a great model. One of my colleagues, his name is Dr. Dugald Seeley, working through the Center for Health Innovation. They have great links with the Ottawa Hospital and provide supportive care for patients. And often there's both referrals as well as clinical trials that are going on there through them. And so sometimes it's that's the way to go. Otherwise, I do recommend, you know, there is an important, from a naturopathic perspective, an organization called the Oncology Association of Naturopathic Physicians. It's a North American association, and that association creates, you know, standards of care guidelines, principles of practice guidelines that the naturopathic doctors who operate within that. There are fellowships and residencies that, you know, for example, our facility was a part of. So this is a good place as a resource for people to look up and be able to access providers in their area. Sometimes there aren't providers with that level of training, but with virtual care now, you know, there's a lot you can access.
Yeah, thank you very much. We'll ensure that we provide the link to that group. We only have a couple of moments left, and Chelsea, I want to go to a really important topic that I know you're very passionate about, and that is the idea of staying mentally and emotionally well during your treatment. And I'd like to close with some brief comments from you on how people can do that. And then I'm going to ask Patricia and Shane to give those one or two, let me call them tips, on what allowed them to be emotionally and mentally well during their treatment. So Trish, the floor is yours, Chelsea.
Thank you, Anne-Marie. So firstly, I just want to say that all emotions are good emotions. We're often taught that feeling sad or angry is a negative thing, but each emotion serves its purpose in life. Anger might protect you against something. Fear might save your life from danger. Sadness communicates that something happened to you that you didn't deserve. And they're all positive things. The best way to address your emotions is to face them. There's a lot of science out there that tells us the more that we distract ourselves from emotions or suppress them, the harder they beg for our attention. So if we ignore them for too long, they will demand your attention by showing up as, you know, maybe physical symptoms or an emotional break. We can prevent this by acknowledging our emotions without judgment, by saying, hey, sadness, or hey, anger, I see you and I feel you. You have every right to be here given what we're going through. Then you can take a deep breath, and as you notice the bodily sensations the emotions give you, whether it's tightness in your throat or nausea, Some folks might find it helpful to visualize the emotion floating down the river after they acknowledge it, or some people envision themselves just flicking the emotion out of the sight. You can be creative in that sense. The main point is that you address the emotion. Now, I get it. If you're at the grocery store and it's not a good time to address an emotion, of course, you want to pack it up in a little box, put it on the highest shelf that you can find, and address it when you get home, and that's perfectly okay. It is a good idea, though, to address the emotion at some point. Now, I also get a lot of clients who say, Chelsea, I try these things. They don't work for me. I do the visualization. I do mindfulness. What is wrong with me? Well, there's nothing wrong with you. It's that you're using the wrong technique for you. The good news about that is that there's thousands of techniques out there that we can try. So don't get discouraged.
Thank you. Shane, what's the one thing you might say to our audience that would help them deal best with their mental and emotional wellness in a way that worked for you?
So what worked for me, when you're diagnosed, there can be those feelings, of course. So why me? What did I do to deserve this? But for me, what worked, I accepted pretty early on. This is the way things are. This is not my fault. This just happened. But I'm not going to feel bad for myself about it. I'm someone who likes a challenge, is goal oriented. So I thought, still not that bad. A lot of people have things worse than me. So I'm going to try to always look on the positive side of things, and not feel too bad for myself. It is what it is. I trust in my care team. I'm going to get great care, and just try not to worry about it too much. But really, just trying to keep a positive mindset, try to look for the good in every situation, even if it might be small and greatly outweighed by the bad. Try to find that bright spot. And then just the physical activity, whatever it is you do, whatever it is you're capable of doing at the stage in your care you're in, whether it's going for swimming, gardening, walking, something that brings you joy. Just, try not to get too down on yourself and spend too much time on the couch. Try to still get up, be as active as you can, and do the things you love.
Thank you. And Patricia, we began with you and we'll close with you. What guidance might you give to our audience on staying emotionally well?
I think just remembering that this isn't linear. Things go up and down and change, and different types of treatment, different points of treatment. So keeping a well-equipped toolbox, and then just knowing that you'll keep dipping back into it, that it's you need different things at different times, and then keep that toolbox and recognize that, you may have to revisit something else might have popped up. And just having that helped me really be able to trust in the healthcare team and everything as well. We keep emphasizing that, but it's so true. You do have to give up a certain amount of privacy. And I know that can happen at different stages in different ways for people. And your independence can be affected. So that's what makes it so personal, and having those tools to dip into to help you at each time, I think, is a really important and valuable to recognize.
Great. Thank you so much. And on that note, I want to thank all of you, Dr. Marsden, Chelsea, Shane, Patricia, for bringing such tremendously open, authentic information to the table today. I know that it is of high value to the people who are watching and listening. And we're now opening the floor for a brief Q&A session where folks can feel free to ask any question they wish of the four panelists here. Hello, everyone. I hope you've been enjoying the conference so far. I'm really thrilled to announce that Shane, Patricia, Chelsea, and Dr. Marsden have agreed to stay to answer the many, many, many questions that we've been receiving are on this session. So I'm going to get right into it. Shane, actually, the first question we have here is directed at you. And the question is, what has been your experience with your ostomy reversal and bowel function afterwards? There's a comment here to say that I'm anxious of what to expect for my own upcoming ileostomy reversal. If you could share your experiences, that would be great.
Sure. So I definitely understand the anxiety. There's a lot more horror stories out there to be found on the internet than positive ones. And I think that kind of comes down to human nature. Just like reviewing a restaurant, you're more likely to do it if you didn't like it than if it was good. I'm happy to say my experience has been really good. And I would encourage anyone to consider a reversal if they are eligible for it. It is hairy in the beginning, I'm not going to lie, especially if you've had the ileostomy for some time and your body hasn't been having to use certain parts. So it definitely is rough for a little bit, but I've found that diet makes a huge difference. Especially increasing your fiber intake. And I was pretty quickly able to reduce the number of trips I was having to make. I'm just a little past 3 months out now, and 3 to 4 times a day is the norm. I definitely see a difference if I'm not eating so good, but there is a lot of stuff that you can do to help things. I will say everyone is different, of course, so nothing is guaranteed, but try to stay positive about it, and really focus on your diet as well, because that will help quite a bit.
Great. Thank you so much. Our next question is actually focused for you, Dr. Marsden, and the question is, treatment can lead to a low libido or hormonal changes. What are things that can be done about that, or is there supplements or anything else that you might recommend to improve libido?
And I saw that there's also, if I'm comfortable with that, actually this is so important. So many people going through the cancer journey experience changes in their sexual health. And as providers, many times we're either too busy or too uncomfortable to ask that question to explore. And it's really, really critical. So, there's estimates of between 70 and 80% of individuals. So this is really important. And yes, there's lots of things that can be done. Libido is a very complex thing. So we tend to always associate libido with hormone shifts, but not always. Stress plays a very important role, physical activity or inactivity. So normally when we want to look at individuals who are experiencing issues around sexual health, so libido, for example, is we want to do sort of a full history, do look at the hormones. There are different ways in which we can address hormonal shifts, whether it ranging from certain herbs that can positively impact the production of certain hormones, whether it be testosterone or estrogen. We can also look at even using a hormone replacement therapy where appropriate. And then, of course, we can use other things to support hormonal and sexual health. Sometimes there's things like vaginal supplementation, there are erectile dysfunction medications, drugs, herbs, acupuncture, counseling, therapy. These are critical because, again, libido is such a multi-dimensional thing. So yeah, there's lots of things it can do, and we should all be talking about it because it's an important part of almost everyone's lives.
Yeah, no, thank you very much for bringing a light to this, and thank you for the question as well. There's a next couple of questions that I think, a combination of Shane and Patricia and Chelsea, I'd like to bring you into this conversation as well. It's around this ways in which you're able to balance or respect your pace, your physical limitations, while leading an active, meaningful, enjoyable life. Another way this question has been framed is the frustration of wanting to do things, but not necessarily being able to do them to the level we want that. So maybe, Patricia, we can begin with you. How did you balance out your own used to be able to pace with the abilities that your cancer may have limited you on. So let's start there.
I think that one of the key pieces too is that it's often can be the cancer that's tiring and not just the treatment, and letting folks know that the treatment can be a lot, but it's also that your body, you have cancer. For balancing, sort of the frustration and things like that too, I have found that the age, the different support groups for different stages of life have been useful. Some of the folks that I've talked to, their lifestyle, if all their social group is retired, is maybe different than your lifestyle at other stages. And that can almost increase frustration a little bit on some in some ways. And then just surrounding yourself with folks who just appreciate and assist with whatever it is you're able to do at the time.
Mm-hmm. Thank you. Shane, I'd like to get your thoughts on this too, particularly, I've understood you're a very active person, and sometimes going through treatment can limit that and the frustrations that build around that. What are ways in which you had addressed that balance issue?
Yeah, I can definitely understand that frustration. I'm not the most patient person, and when I have goals of what I want to do, I'm very dead set. This is what I want to do, but you need to remain adaptable. I think that's the biggest thing. You need to make substitutions and just be patient and give yourself a break. If you have a training plan or something you're working towards, you might have to rethink your goals. Just find what works for you. Find something that you enjoy, and just keep trying to do what you can as best as you can where you're at in your journey.
Thank you. Chelsea, I'd love to get your thoughts on this, because you certainly have a broad range of experiences with a number of people who probably ask you this question often.
Absolutely. So what I would say is give yourself some grace, right? Recognize that your body is going through or has gone through a lot. You will require some time to recover. We can be so hard on ourselves to get back to normal, to really go out and work really hard despite how we're feeling. So setting those realistic expectations for yourself might be a good start. You might find it helpful to schedule activities into your day that you're able to do and also brings you joy in the beginning, and work your way to going back to the activities that you did before. So that notion that small steps make big changes is what I would say.
Right. Thank you. Dr. Marston, this is a big question that I'm going to throw at you right now. So we'll break it down a little bit. The question is actually framed as, is there evidence to show how non-conventional treatments alongside conventional treatments can benefit cancer treatment overall? I have to believe that some of that's very dependent on the non-conventional treatment in pairing with a traditional treatment. So I'll let you kind of unpack that question a little bit in a way you think is most helpful.
Yeah, I mean, I think it's an excellent question. It's a hard question to answer, because non-conventional treatments, as you mentioned, there's so many things out there. And so the quick answer is yes, there's quite a bit of evidence looking at non-conventional approaches and in combination with conventional approaches. Now, I say that with a bit of a caveat. There are some limitations around non-conventional therapies. Unfortunately, there's not as much money to put towards clinical trials for a lot of different things where there isn't a monetary benefit. And that includes non-conventional therapies, which most are not patentable. So a lot of times there's criticism of the clinical trial evidence that their smaller clinical trials are not as high quality. But there is increasing amounts, especially over the last 20 years, for the National Institute for Complementary and Alternative Medicine in the United States, which has then been changed, has really funded quite a lot of this. So yes, there is quite a bit of clinical trial data. A lot of conventional oncologists will say not enough for certain things, but certainly we know that there are many therapies that appear very safe and have good quality of evidence, whether it's about treating and preventing neuropathy or infection and immune suppression, or improving fatigue, and other quality of life measures. There's quite a few therapeutic options out there with randomized controlled trials. A lot of times it's hard to placebo control certain trials, and ethically it can be a real challenge as well. But yes, there is quite a lot out there. And in fact, there's an entire site called No Oncology, which goes into summarizing a lot of this data on a regular basis.
Yeah, thank you very much for that. If I could just ask you to highlight maybe the top 3 to 5, what we'll call non-traditional therapies that, you know, are in the literature right now, just so people have a sense of what those might be. What would it be? Food? Would it be?
Yeah, I mean, so embarrassingly, there's very little data on food. From a during treatment perspective, we have some small clinical trial data about ways to minimize gastrointestinal irritation and mucositis, but there should be way more. There is increasing data on the use of fasting during chemotherapeutic interventions and being done properly, where it can potentially improve outcomes in terms of treatment responses, as well as help with things like gastrointestinal side effects. There are certain herbs like mistletoe, like ginseng, maitake, and other mushrooms, which have been shown to help with quality of life, adverse events, particularly fatigue, infections, and so on. There are things like omega-3 as a supplementation for neuropathy, lipoic acid for recovery for neuropathy, and I'm missing, and vitamin D would probably say there's quite a bit when we look at vitamin D. The argument is there's very little argument that people with better levels of vitamin D do better, both in terms of success of treatment, long-term survival, et cetera. But we don't always know, well, treating with vitamin D. So we have limited trial data, but it's an easy, cheap supplement that people can take and definitely is safe when monitored.
Yeah, thank you very much for highlighting those. And it's a bridge kind of to the next question. I want to bring everybody into this conversation, and it's really about the question is around alternative approaches to managing chronic pain, which is incredibly common during cancer treatments. So I'd be interested to understand, Patricia and Shane, from your perspective, if you did try any alternative approaches. Dr. Marsden, what is some of the literature on the management of chronic neuropathy, chronic pain? And Chelsea, I would love to get your perspective too. Let's start with you, Patricia. Is there anything that around the pain issue that you personally tried successfully?
I do have neuropathy in my hands and feet, and which had occurred after the chemo. I do find physio and acupuncture and yoga have been helping. But at the same time, I'm also healing from surgery. So I think it's everything put together. And honestly, I also am taking gabapentin for the nerve pain itself. So it's the combo for me that I'm working on.
Yeah, thank you for sharing that. Shane?
So I was fortunate not to really have neuropathy too bad. It really only kind of came on actually when I finished my final cycle. And it kind of went away on its own after 3 to 4 months. In terms of pain, I just found I had a lot of stiffness and muscle soreness throughout treatments and just from being less mobile. So I find I really try to focus now on mobility work as well, just maintaining flexibility. You know, we're not so active these days. We sit at desks a lot and whatnot. So something I'm really a big fan of.
Great, thank you. Chelsea, any further insight you can add and build on?
I would say for chronic pain or chronic physical symptoms, if you're experiencing a lot of stress, chronic stress, then it can come out in a physical way. I've seen patients find it helpful to engage in therapy, whether it's cognitive behavioral therapy or acceptance and commitment therapy, with a combination of biofeedback as well and some somatic exercises with either a therapist or a physiotherapist. So that's what I have experienced with speaking with other patients.
Yeah. Dr. Marston, because this is an area of expertise, it cycles back into the whole issue of non-traditional approaches. But what are some of your recommendations for chronic pain, for neuropathy that you might advise?
Yeah, well, I mean, we've already heard quite a few of those in terms of movement being a huge thing, acupuncture, yoga, mindfulness, and other cognitive behavioral therapy techniques can be incredibly successful at supporting that. Medication like gabapentin are also important. Some other sort of non-conventional approaches. We talked about things like high-dose omega-3 supplements. These are your fish oils and other types of omega-3 oils that have some options. Aggressive therapies with high dose lipoic acid. There's some small clinical trials and we've seen excess. This is a special antioxidant that has been used to treat diabetic neuropathy and seems to be also helpful in polyneuropathies associated with chemotherapeutic. Low level light laser type treatments also has some excellent evidence behind it, and we've seen it be very successful for patients. And actually, some other, we don't have as much clinical trial, but some anecdotal, even certain essential oil treatments being applied to the feet and the hands can actually help. And even we've seen with some patients where it's been protracted and where maybe they're not responding as well to some of the things like the gabapentin and pregabalin and so on, using cannabinoids or cannabis, which is kind of more in use now, that have been very helpful in terms of pain control and so on. So those are common ones that we see.
Yeah, thank you very much. And it's very exciting to understand what I call the rather expanding world of options to help in these circumstances. So we're at time on the Q&A. I want to thank Chelsea and Patricia and Shane and Dr. Marston again for staying to answer questions. If your question did not get answered and you do have more, please feel free to reach out to the team at Colorectal Cancer Canada, and they would be very, very happy to help you. I also want to tell you that all of the sessions that are part of this conference will be made available after the conference through Colorectal Cancer Canada's YouTube channel, and you'll be receiving communication on that.